Viewers, I am Kalaivani from SNS College of Pharmacy and Health Sciences, and today we are going to see about HIV, that is Human Immunodeficiency Virus. It affects directly the immune system of a human, and it tries to create the immune deficiency towards other infections or usually kinds of diseases. And this HIV causes AIDS, that is acute immunodeficiency virus. And here two types of HIV are, that is this HIV-1 and AIDS, that is spread in US and worldwide, and HIV-2, that is AIDS in Western Africa and Southern Asia part. So coming to this HIV virus, what is HIV actually? We all know that it is only a human deficiency virus, and it is consists of CD4 cells. That is, the cells is called the CD4 plus cells, and dendritic cells, macrophage, T helper cells. So these cells will get affected with this HIV, that is CD4 molecule, which helps in immune cells communications will get affected, and then this is the pathophysiology of the HIV disease. And important, the CD4 molecule cell is very important for the immune system to get work. This CD4 cell will get incorporated with the GP120 of the HIV, and then it will get bond with the CO receptor of the CD4 cells, and then inside the cell, what will be happening? CO in the that is in the CO4 receptor. That is CXCR4, it is called as T cells, and CCRS, it is known as T cells, macrophages, monocytes, etc. And dendritic cells is also called as CCRS. These are the molecules present in the CD4 cells, and here the homozygous mutation will be get happened when the HIV links with the CD4 cells immune system, and here the resistance and immunity will get fight, and then heterozygous mutations will also be getting happen where slower disease progression will be happening. That is with the CCRS and all. And now if the cell inside the cell wall may get eradicated, and a single stranded of RNA from the retrovirus, that is HIV, will get into the cell body of it, and then the retrovirus RNA will get means multiplicated, and then it will have a reverse transcriptase, and it will form into a chromosome DNA, that is pyroviral DNA. It will get converted into pyroviral DNA, that is integrate into DNA of the host DNA, that is our DNA. It will get into our DNA material. It will bind with our DNA material, like the host own DNA, and the cells of the human body may get activated with the proteins for the immune response. So now the completely that is the infected cells may get multiplicated in our human body cells, where the immune system may get protected and may get fight with the cells, but it will fails to get eradicate of the HIV, that is immunodeficiency virus. And now the errors during replications, different strains may get multiplicated and spread into our body bloodstream, and then here our target different cells will be there. There is viral tropopsia, it will be called as. And now the infected persons, when they get an sexual intercourse or any other blood transfusion or any other things like transfusion methods, like any body fluids like that, your infection, that is RS strain, binds to CCRS of the healthy host, and again there the same process, CD4 cells eradication, everything will be happen, and the epithelial or mucosal tissues containing the HIV may transfer the HIV disease to the immune nodes of the healthy body, and here all the cells other means the healthy immune systems may get again infected for the fresh human being, and here the HIV in blood will get flu-like symptoms into a healthy host. So this is now said to be HIV pathophysiology. And here see, if it is spreading like a flu, and counter attack like controlled replications will not be getting happen, and in a healthy human being, the acute phase is of about 12 weeks, and the chronic phase is about 2 to 10 years. and number of the T cells may get eradicated, reduce in the acute, and in the chronic also it may get reduced, it may get elevated like some up and downs. And in chronic phase, the virus increases in the T cells and the T cells decreases in our human body. That is 1 to 2 billion per day the T cells decrease in our body, and greater than 500 cells, that is greater than 500 cells millimeter per cube, and still the fighting of the infections will be happen in our body because some become more severe, and then that immune system may get boosted upon fighting with the HIV present in our blood. Then exposed strain maybe lead to the T cells and the CXCR4, and it will goes to the lymphoid of the tissues, and then it will 90% of the tissues may, that is T cells may get affected with this lymphoid tissue. And here the exposed strain which was affected with the cells may not present in the human being, and nearly 200 to 500 T cells per millimeter cube, that is swollen lymph nodes, lymphadenopathy, hairy leukoplakia, white patch on tongue caused by Epstein Barr. These and all will be caused by the effect of the decrease in the T cells, that is oral candidiasis, yeast infection, that and all. So this is the pathophysiology and some diagnosing of the HIV present in our body, that is AIDS, and it is also known as immune system severely compromised, and persistent fever, fatigue, weight loss, diarrhea, everything will be affected by the host that carries AIDS, or that is our HIV. And it is a recurrent bacterial pneumonia, and fungal infections, candidiasis of esophagus may also be appeared. Some tumors may arise, that is called as Kaposi sarcoma, skin lesions, etc., primary lymphoma, like that and all. And now we can't say there is a permanent cure for the HIV disease, but there is still as what to say, temporary postponing like that is there. And transmission male to male in US and male to female, resource limited settings, etc. is also there. So thank you dear guys. So today we've seen something about HIV, and I'm clear that I hope that you may understand something. Thank you so much.